host, Nick Jikomes, and today I'm speaking with Dr. Jay Bhattacharya. Jay is a professor of medicine, as well as a professor of economics and in health research and policy at Stanford University. He has a MD as well as a Ph.D., but he has spent his career as a researcher. His expertise is primarily in the general area of infectious disease epidemiology and public health and public policy. Jay has been very active in sort of discussing publicly different aspects of the COVID-19 pandemic. So we talked about different aspects of the pandemic. I talked to him about how infectious, transmissible, and deadly COVID is and how our knowledge of those things has changed over time from the beginning of the pandemic to the present moment. We talked about things like natural immunity versus vaccine-induced immunity and whether or not the strength of your immune response will be different depending on if you've got one or both of those. We talked about the mRNA vaccines that were developed for COVID, a little bit about how they work and how they were implemented. We talked about what we know in terms of, whether or not these vaccines are preventing severe illness versus transmissibility and what that means. We talked about what's known today about any potential negative side effects from the vaccines. So we got into a short discussion about myocarditis rates in men versus women and younger versus older individuals. We talked about the evolution of novel COVID variants and how that plays into all of this. We talked about things like masking, what we knew about masking early on in the pandemic and what we know today, how effective really are cloth masks versus N95 masks, and what does all of that mean? And we got into a discussion around the institution of science and free speech. Some of it centered around the fact that Jay was personally named in some of the recent Twitter files, information dumps that happened on Twitter. Jay's account was actually specifically but suppressed in certain ways over the last year or so because of who he is and some of the stances he's taken with respect to COVID policy in the US. So his account was actually suppressed and his tweets were prevented from being boosted in certain ways on Twitter. And so we talked about that. We talked about his recent trip to Twitter headquarters and what it was like meeting Elon Musk and what he thinks about him. We talked about the public perception of experts and scientific authorities at places like the NIH and the public health institutions of the US, the relationship between science and the public and what's been going on with the public's trust in science. We talked about, his sort of bird's eye view of how he thought the US handled the pandemic compared to other countries, what he thinks about lockdowns versus focused protection strategies for mitigating things like a viral pandemic like this. And all of those topics obviously interrelate, and we got into all of them a fair amount. So if you're interested in COVID-19 and understanding, whether or not our response to it was effective or could have been done better, the understanding things like how well or how poorly masks work at actually protecting you from transmission, and things related to the vaccines and what they do and what they don't do, this will be an interesting episode for you. It's also interesting from the perspective of, just thinking about issues like free speech and, the public discussion and debates that people like to have around scientific issues as they relate to public policy, specifically in the context of COVID. So we touch on all of those things. As always, if you enjoy the content I am producing here, please like, share, and subscribe wherever you are listening or watching. This introduction will be on YouTube, but the full episode will not go onto YouTube. I had a previous discussion with the epidemiologist Martin Koldorf actually pulled down for YouTube. They said it violated some of their policies, but they were not able to tell me specifically what piece of content inside of that conversation actually violated those policies, and I could not tell that anything did. So because we're talking about the subject, and for better or worse, because all of these subjects are fairly controversial, I decided not to put the full episode on YouTube, but there are links in the episode description where you can get access to the full audio and video versions. This episode is supported in part by Athletic Greens. Their main product, AG1, is a comprehensive and convenient daily nutrition product containing 75 vitamins, minerals, and whole food sourced ingredients with less than 1 gram of sugar per serving, no nasty chemicals or artificial anything. It's gluten and dairy free and compatible with paleo, vegan, vegetarian, and ketogenic diets. AG1 is a quick and convenient way to supplement your diet to help ensure your body is getting the nutrients it needs. It comes in powder form, and you can mix mix it in water and drink it, or you can put it into a smoothie or a shake or something like that. I mix it into water and drink it with the first meal of each day, and it's super convenient. If you go to athleticgreens.com/mindandmatter, Athletic Greens will give you a free 1-year supply of vitamin D and 5 free travel packs with your first purchase. Their vitamin D product comes in tincture form, so you just take 1 drop each day. A large fraction of the population is actually vitamin D deficient, especially in winter months when we get less sun exposure. And vitamin D is super important for the proper function of the immune system and for a variety of other things. And there's even evidence indicating that vitamin D deficiency is correlated with more severe cases of COVID-19 in those who get infected. Every time I go into the doctor each year for a checkup, I'm always told that vitamin D deficiency is very common and I should be supplementing on a daily basis. So visit athleticgreens.com/mindandmatter or click the link in the episode description. You'll get a free 1-year supply of vitamin D with your first purchase. And with that, here's my conversation with Dr. Jay Bhattacharya. Can you tell, for people that don't know you already, a little bit about your scientific background and what you do?